Dr. Taj Hassan. Dr. Taj Hassan is the college representative from the Royal College of Emergency Medicine. He's a consultant in emergency medicine at the Leeds Teaching Hospital NHS Trust, and also the president of the Royal College of Emergency Medicine. He has previously held posts at NHS, Improvement as an Associate Medical Director, Vice President of the Royal College of Emergency Medicine, and Director of e-learning at the college. His major interests include emergency medicine design, system design, creating workforce resilience and sustainability through leadership development. He previously led on and helped devise the Invited Service Review Program for the Royal College of Emergency Medicine in the post-mid-staff report era. Internationally, he has been involved in developing leadership, training programs for the International Federation of Emergency Medicine, and linking to help support developing countries in their emergency medicine system development. It's my honor to welcome Dr. Taj Hassan.
Thank you very much, Junaid. Thank you for the very kind introduction. It's a real honor to be here. It's my first ESEM conference, and I just about made it. I landed about an hour and a quarter ago, so it's all good. Very well planned. I've got this title that I thought I would talk to you about. I've just been listening to Colin's fantastic presentation, and it was filled with superb science, and this has no science. Okay, this is the joy of soft skills, of the things that we all feel sometimes is a bit of an art form, and some people are incredibly natural, and others, like me, have sort of worked hard at to become leaders. But we're all leaders, and it's an emerging area that we're trying to embed at the very heart of our junior doctors, and then this journey that we have right through our clinical careers. So I hope you enjoy it. I've tried to make it as generic as possible and identify some hooks that perhaps will resonate with you. So we'll see how we go. I think I've got about 35 minutes or so. So this is where I work. This is the Leeds General Infirmary. It's a major trauma center. It sees about 130,000 new patient attendances per year. And we're pretty busy. We might not be busy compared to other systems, but we're busy enough. And the guy in the foreground was a guy called Maurice Ellis, and he was the first ever A&E consultant in the country, in the UK, if not, people say, in the world. First formalized A&E consultant in 1954. And in 1967, on October the 12th, he set up with 8 other people something called the Casualty Surgeons Association, which became the Royal College of Emergency Medicine. So this year we are celebrating 50 years of our specialty in the UK, and we're very proud and very privileged, and we've done lots of things, and some of those you will have seen perhaps if you follow Twitter. Anyway, so we're busy enough. As you can see, we have a fantastic design at the front of our emergency department. We have a maze. We identify, hopefully, patients sort of filter into the maze and they filter out and they don't come to the emergency department at all. It's a very good way to stop patients attending. I recommend you build a maze. It's a good thing. I was pointing this out to my son, and he said, "The maze doesn't work, Daddy. You're a president. Build a wall." We should move on. Okay. Okay, this is what I'm going to talk about. I'm going to talk a bit about defining reality, where you are, where you work. It's all individual to you. Knowing yourself and how you function, how you build upon improving yourself, and creating your path. And I think that's really important for all of us as we progress through incredible times for our specialty in terms of the skills that we want to deliver for our patients. So defining reality, this is in the UK, this is a big thing. Those of you who work in the UK, every autumn we have this thing where we start preparing for winter. We prepare for winter because we know it's going to be terrible. There are not enough beds. The departments will become very crowded. There'll be lots of flu, and our media make quite a big deal of it. The reality is actually that we seem to be, winter is all year round for us in the UK, not just the weather, but is due to the fact that our resources are incredibly constrained, and we have difficult conversations with our politicians where we try and explain to them that if they don't spend enough money, then they won't get the care that the public deserve, and then they might be voted out. So that does perk up their ears. Okay, so when you define reality, you probably need to understand some of the elephants in the room. What are the actual big things that we think are important? And in any system, whether it's in the UK, Hong Kong, the United States, or here in the Middle East, there is no doubt that you have to look at your demand. You have to look at the complexity of the patients that you're managing. So for us in the UK, the elderly population, and I think in many parts of the world, as the elderly population rises, it's become incredibly difficult to manage these patients well enough in a busy ED setting. And then, of course, linked to outcomes, and Colin's excellent presentation highlighted that. And we all probably agree that we're behind the curve on resource. How do we connect to make it cost effective? There's no doubt that technology and diagnostics have improved and therapies have improved, but the number of beds available in our system have decreased, and that makes it really difficult. So those are really obvious things. We also know that actually, if you go back to Deming, one of the great gurus of management, and he talked about minimizing variation. And if you look at your own systems, there are huge variations in systems, in the staffing structures that there are, and the supports around them. But even worse, there are huge differences in behaviors of people within those systems. So really, at the heart of it, what creates a positive momentum, what creates the ability to deliver decent care, is when you start having an organization and a department that has shared values, that collaborates well, creates the right culture, is patient-centered, is patient-focused. And for that, you need leadership. And you need leadership at every level, but you need it not just in name, that somebody is the clinical director, but that person has huge responsibility. And some of you will have, I'm sure, read perhaps a guy called Michael West in the UK. He's certainly one of my heroes. And he talks about this concept of collaborative leadership, collective leadership, and kind leadership, which is really powerful. So in the midst of that, this is what we all crave, I'm sure. We all crave happiness, we all crave the ability to create this mixture of within life, which people sometimes call work-life balance, or life-work balance, or whatever you may call it. But really, in the setting aside your personal life, because I can't give you any guidance on that, but in terms of our professional lives, those issues, shared values, collaboration, culture, and system leadership, I would suggest to you lie at the very heart of being able to be not only satisfied and in your clinical career, but lead a successful career, and for it to be sustainable. We're all going to live much longer than our parents, one would hope, and you will certainly be expected to work much longer than our parents. So in the midst of this is what we are, this is who we are, and that's the real challenge, but also a real joy. You know, being an emergency physician at the top is what your core job is, but over your clinical career, you have an opportunity to mold your portfolio every 5 to 7 years to really stay stimulated, stay excited, stay enthused. And within that, I'm sure there are things that you will always continue to do. You'll always be a diagnostician, a resuscitationist, a team leader, but you may, and a mentor, but you may go into risk management, or you may go into tech informatics, or you may do humanitarian work. So that ability within emergency medicine is unique, and that's one of the joys of our specialty and why we attract enthusiastic young trainees, but we also have to nurture them. So the pursuit of happiness and a quieter life can also be sort of, if we pull into that a little bit more, one of the things that I suppose perhaps keeps us awake at night is how do I maintain my performance to practice best judgment? When you're standing in resus and it's all a bit hot and difficult and you're making that tough judgment call, how do you connect your experience, expertise, and the latest knowledge set to make sure that you're doing the right thing? How do you navigate your path and your passion for EM? How do you take care of yourself and your team? Because actually, if you don't take care of yourself, and if you don't take care of your team around you when things are really busy, they will feel that you're failing them. And if they start feeling that, they will not function well. And if they don't function well, your patients will suffer and your department will suffer. We all know that. So I would say to you, I would put to you that that is a really big issue, and it's something that we certainly in the UK have only in recent years grasped really well. There's something in there about maintaining motivation. We'll talk about that. And then there's a bit there at the top about being emotionally intelligent. You will know that many organizations now don't sort of give you IQ tests. It's sort of your EQ, your emotional quotient. And that is, so one of my other heroes, a guy called Daniel Goleman, I'm sure you will have read, talks a lot about emotional intelligence in the last 10, 15 years. And that sort of, some people are naturally like that. They're very calm, collected. Others are a bit sort of angst-filled, and how do you support them? But the reality is you can, and that's through a power of reflection, and we'll talk about that. So these are sort of some bits and pieces that we'll touch upon. I may not have time to go through all of those, but a few. But if the cartoon equivalent of that leadership resilience is really that, it's how well you bounce. Life is tough at a number of levels. So accepting the fact that we'll assume that your personal life is stable and fantastic, but actually your professional life in itself can be a real challenge. But we know, of course, that our personal lives, whether our children are not doing exactly what they should, whether often my wife has told me all the things that I've done wrong in the last 48 hours. And as I make my list of all those things, that becomes a challenge which might impact on my clinical career. So those are all things to think about. We also need to think a little bit about how much stress is good, okay? And so this is a very famous graph. I'm sure you'll be familiar with it, Doç.Dr. And it really describes this concept of emotional arousal and performance. And so you need to be, people talk about being in the zone. You need to have enough catecholamines driving and delivering, because performance, optimal performance, and optimal performance, I don't mean as an athlete or as a ballet dancer. I mean optimal performance about standing in the middle of your emergency department with 80 undifferentiated patients, staff running around, and you being the leader, okay? How do you connect them to do really well? That's your job, to be mentally, optimally high, and that requires a particular skill set. So you need a certain catecholamine surge to get there, but actually, if you get too much and you get too stressed, that compromises and you make bad judgments. So that's the zone to be in, hey? So here's a guy I really like. It's a guy called Daniel Pink. You may have come across him, and he talks about the puzzle of motivation. What gets you out of bed in the morning? What gets you out of bed in the morning for a year, 5 years, 10 years? How do you keep going? And people have lots of drivers for that process. But he talks about three things. He talks about autonomy, mastery, and purpose. Okay, and I recommend his book to you called Drive, which is fantastic. And autonomy, we all crave a bit of autonomy. If we are told by our boss to do X, Y, Z, go and sort out, go and see patients in the minors area because it's too busy. You know, you go and do it. You don't feel particularly enthused by it. But if he says to you, you know, I've got a real problem in minors, I was wondering whether you could take a nurse or two and one of the juniors and see if you could set up a quick system and see how you get on. It'd be a real challenge, and come back to me if I can help you. It's a completely different spin. But of course, we know that when we're stressed, we are inclined to say things like, can you go and sort minors out? And that's not, of course, the challenge. That's one example. I'm sure we have many others. Mastery, so the autonomy of life is also about how can I control my life, the path that I want in 5 or 10 years' time. And the mastery is around what you've chosen. You've chosen emergency medicine, I hope, if I'm at the right conference. But we're all emergency physicians. But within that previous slide I put up, you want to master a particular subspecialty. It may be education, it may be simulation, it may be ultrasound, it may be critical care, it may be humanitarian work. The opportunities are vast, and of course that drives you. That's a real passion then, and you suddenly become the expert in your chosen field, and that stimulates you further if you could go back to the science. So I would say, I haven't put up the science slides, but Pink's work is based on good clinical psychology. This is not sort of just words ripped out of the air. And the last thing is purpose, okay? So the purpose of life, of what you're trying to do, and you have to have a vision, something to march towards. So I had some difficult conversations with the Department of Health recently around our workforce planning in the UK. And I was pretty blunt. I said, you know, at the moment, they just, you know, the people out there think you're pretty hopeless because there's no shared vision. And my job is to help with creating that shared vision. And after 9 months, actually, on October the 12th, on our 50th birthday, we launched the biggest workforce strategy in college history. And it will probably affect us for the next decade. And it's something we're really proud of. But it took 9 months of hard graft to say, what is our purpose? Why are we doing this? What is the vision that we can get people to march towards? And so that's a good outcome for us, and one example. So here's another book for you, which I don't know if you've read. So Malcolm Gladwell's, a fantastic author. If you haven't read Outliers, he talks about this 10,000-hour rule and how people become true experts when they get anywhere near 10,000 hours. Now, and that doesn't matter whether you're a ballet dancer or a chess player or an athlete or a musician or an emergency physician. Okay, so in the old days, old people like me We're now training, we probably did 10 or 12,000 hours, and Colin would nod in that direction, being from the UK. But the modern day trainees probably only do 5,000 or 6,000 hours. So that's a bit of a challenge for them, because they're now trained, inverted commas, but they're coming into a tough system, and they're finding that they struggle. And of course, they're having to move up that path. So that's something that we're having to really think about. That's something I'm having to really think about as college president, about how we support our trainees better. And actually, Gladwell's work links to a wider concept which has been around a long time, of deliberate practice. The more you do of something, the better you'll get, which of course then links back to the purpose and the motivation. If you do the same thing and it's a bit boring and you have no purpose, you eventually get bored. But if you have a purpose and want to be an amazing emergency physician, you'll see those patients over and over again till you get better, and it becomes a sort of metacognitive spinal reflex. Okay. So very quickly, because my time is running out. So this is at the heart of, this is what probably, as we come into the emergency department, the joy is you don't know what you're going to be facing, but you hope that all your training and everything has given you the ability to have wisdom and judgment. And so that will be based upon cognitive skill sets, your skills that you've learned, psychomotor, and your attitude. You'll then pick up these other bits and pieces, and you'll have some guidelines, no doubt, and maybe you'll just have natural great language skills, because we all know, actually, the most difficult patients in terms of conflict resolution, or the difficult specialties in terms of conflict resolution, if you've got great communication skills and people skills, suddenly everything is pretty good. Over the years, I've honed my conflict resolution skills from my early days, where I was perhaps a little too aggressive. And I remember my first week as a registrar in emergency medicine, one of the orthopedic registrars was incredibly rude. I don't know why it should be orthopedics, but he was incredibly rude, and I allowed him a couple of goes at being incredibly rude, and then I took him aside and said, we've only met a couple of times, and I've decided one of us has got a personality disorder, and it's not me. He found that incredibly difficult initially, but enlightening eventually. And we became friends after a while. Anyway, so deliberate practice, experiential learning, all these other bits, neural nets, artificial intelligence is now the in thing. We'll have driverless cars. In my first AI project I was involved in was a chest pain evaluation project in 1996, actually. So it's good 20 years later. And it worked, but we never progressed because it was all a bit slow. But there we go. And then we have these other things. And this, I would suggest to you, these are the ingredients of what makes good judgment. Okay, and that's really, really quite challenging. And how do you connect all those dots together to be able to grasp and maintain a pathway of excellence in emergency care? So you can do simulation. Obviously, that's become the really big thing, and there are incredible simulation centers both here in Dubai as well as all over the world. A few more minutes to care. I put that in because one of the things I tell my juniors is, in the hurly-burly of the emergency department, the most important thing I would suggest to you is the last 3 minutes of the consultation with your patient. If you can give them an extra 3 minutes on top of what you thought was okay, they will really appreciate it. And that involves just speaking in their lay language, in simple language, explaining again, and reassuring them and giving them the right safety net advice. And you will see, not only will they appreciate it, and studies have confirmed all of this, prolonged contact of the key things, So this is really based on good evidence, especially in general practice. But actually, you will be energized by that process, okay? You will be energized by that process because they will exude to you and come across to you that actually that person really means it and they care. And we have a remarkable privilege, of course, in medicine, is that we interact with some of these people's lives for sometimes hours, maybe a number of hours, and then we may never see them again. But actually, if you get it right, they will probably remember you perhaps for the rest of their life, which is a remarkable privilege. So some of colleagues, I'm sure many of you read MCRIT, and Michael Laurier's keen on this, is that you can simulate extreme stressful circumstances and expose people to extreme stress, and it'll make them feel better. I'm personally not an advocate of that, I think, but some people are. I put that out to you as one of the options, that you build toughness. I think there is an element of absolute truth in that, when we all work really hard, or do work really hard, but we always say, when I was a junior, I worked really hard. It's much better now. But that was part of building resilience. So if you like Laurier. I really would recommend this one to you. These are all mental frameworks, mental models, and Professor Steve Peters is a psychiatrist and a psychologist, and he wrote this book called The Chimp Paradox. And he describes really all of these, the daily activities of conflict, frustration, angst, and how you manage them. And some people are able to have, on the one hand, a very logical framework saying, gosh, I understand where you're coming from. But innately over here, you'll have your chimp, your inner chimp, which is very sort of almost brainstem angst. And you can just see it happening, and in our department we call it the red mist. And one of my colleagues is really good at and you can see the red mist descending, and everybody gently moving away as he's about to explode, and then he feels better. But of course, that creates problems for staff as well. Amy Cuddy, those of you who've read, talks about body language and body profiling, and she says that actually, again, based on clinical psychology and experiments, that actually just before you go on clinical shift, you should sort of pose as Supergirl or Superman, and that this produces a catecholamine surge, and you'll feel better and you'll perform better. I'm not sure. I don't do that, by the way, just in case any of you want to tweak that, but I put that to you again as a chemical reaction that the body does have. So one of the things that we realized about 6-7 years ago when I was vice president, and was that actually we'd never actually given any guidance to our members and fellows at the college about what to do when you get pretty stressed, or what to do as you go through your career and feel a bit run down, or feel a bit burnt out, or have compassion fatigue. And I was very lucky. It's probably the best thing I've ever been involved in. I was the chair of this group, which was called a sustainability group, for 6 months, and we produced this output. It's on our college website. You can find it. And it stands the test of time. It really does. There's no papers and stuff. I mean, there have been lots of papers subsequently about burnout, but actually, in terms of finding solutions, this is a very solutions-orientated strategy, and I'd recommend that to you. It has, obviously, British connotations around rota planning, some bits of it, but you can extrapolate it really pretty easily. As we know, it's when you're working in a team, and the things that make things go really well is when you're all connected, and that can be quite challenging because you may not have chosen your team, and And so you have to align personality types, and you have to align communication skill sets, and you have to align the abilities. But, you know, when you're really wanting to achieve something in your department, one of the best ways to do it is to have a small group of people that you really trust, and then drive that change program, and then build relationships and the web around it. And suddenly you create momentum. And we all do that, don't we? We have maybe 2 or 3 other people that we start with an idea and then we build outwards. And it's really, the slide is there just to reinforce that point. And the wider team I've spoken about. So emergency medicine is just incredibly unique. You know, we interact with, out there, the primary care system, but then these joyous specialties within our hospital, many of whom now clearly respect us, some of whom still don't. And then within that, you get colleagues who are difficult, and you have colleagues who are tired. You have colleagues who are really busy, they're having their own stresses, and trying to find ways to align everything so that you can say, we're all pushing in the same direction. And there's lots of strategies. I haven't got time to go through that now. Multidisciplinary meetings are one, setting clear goals around how you set up MDT programs is a really good way to build better relations, for sure. I talked about workforce planning. This is a pretty complex slide, actually, that we've just sort of been trying to describe more clearly, about the fact that there aren't enough doctors in our system, so we have a multidisciplinary clinical workforce. I'm sure that probably affects some of you as well. And our senior decision-maker layer are these senior trainees and consultants and others, and we've got a program around attracting, recruiting, and retaining. And the reason I put that slide up for you is the complexity of the workforce. So you're the team leader in the midst of that complex workforce. So you may not be in charge of all of them, or you may be, you know, you will have delegated your responsibilities to the various colleagues. So how do you best build that framework and keep it tight? The workforce is the number 1 issue, I would say to you, and probably number 2 and number 3. So if you've got the happy workforce and you're training them and valuing them and caring for them, you'll run a brilliant department. Accept the fact that you will get tired. Accept the fact that you will have these negative inputs which will drain your mental energy bank. And accept the fact that you'll have good things, and those positive inputs will energize you. And I would think about what energizes you, and only you will know that, but it's important. I'm just going to skip over that. These are just some publications where we talked about compassion fatigue and burnout. So you really want to be in the blue zone, don't you? You want to be high-performing, satisfied, resilient, well. Don't want to be at the other end. So, you know, people look at that and go, gosh, that's so, you know, that's so through a career. I can move from the blue zone to the red zone through one clinical shift. I don't know about you. It suddenly feels a bit sort of tiring. And so you go and have a coffee, or you rock in the corner gently till the nurse brings you out. It doesn't really matter, but actually I don't do that. It's fine. So, you know, it's just an appreciation of the framework of where you are, and how you make sure that you stay in the blue zone. Eat well, exercise well, spend time with your family, compartmentalize your work routine, all of those things. This is a paper by Wallace back in 2009. This is my one scientific paper. You'll be pleased with me, Colin. And he talks about a missing quality indicator. It's a great paper. I would recommend it to you. But the point is, don't get into the stage of burnout. Really identify, get to the point before then of putting in place systems that will care for people. Another book for you, Sean Acor is a guy who's based in Boston, and he's a clinical psychologist. And he's got it. I don't have shares in any of these books, by the way, but I do like reading them. And it comes back to that point I made earlier about the 3 or 4 minutes extra with the patient. And actually, what that does, and so this ACOR's work is based on all really good science, and what that does, those 3 or 4 minutes are good for the patient. They get good safety netting, and we tick a box, and that feels right. But actually, it energizes you because you've performed in the patient's eyes an act of kindness. Yeah? And we've all seen that, haven't we? We've all seen that ability when we're quite kind to some patients and others we don't have enough time for, and then we rush by. For whatever reason, we don't perhaps like them, I don't know. But actually, if you're kind to those patients, and that energizes you, and it's proven chemically, and that will make you happier. Okay, so that's something I would recommend to you. And he's got some other bits and pieces, I haven't got time, but at the bottom is important. He talks about this concept of social networks and the power of social networks. And that sort of, again, comes down to this issue of friendships, but actually clinical friendships and strength of your team within your ED and caring for your workforce. You can actually extrapolate that really well. I don't know why I put this slide up. I think it was to show off our college strategy. So I started as college president 14 months ago, and I scrapped the first 2 council meetings, and we had strategy meetings to define what we were going to do for the next 3 years. And my council were really upset. They said, "But we've never done this before." And I was like, "Well, don't you think it'd be good to sort of work out where we're going?" And so we did. We spent about 3 or 4 months in a bit of pain, but actually we gelled together, and that was really good for council. It was really good for executive, and that's the vision that we are marching towards. There are 10 strands, 3 themes, and I would suggest to you that's actually, generalizable to your departments. No doubt you will have a 3-year vision for your department. Perhaps you're in the middle of it. Perhaps you haven't started it. But I would suggest to you that's a really good way of looking at your team, if you're a team leader, of saying, what do we want to build? What are we proud of? What do we want to drive for? And these are, for us, around staffing, systems, and support. You'll find them on our college website if you're interested. I'm just coming very much to the end. I'm sorry it's occupied a bit more time. So in the internet era, you have phrases like this. It says, "The successful teacher is no longer on a height pumping knowledge. He is a senior student, anxious to help his or her juniors." Yeah, so, gone are the days, gone should be the days, actually, of things like this, me standing here lecturing, feeding you information, and that actually it's a much more facilitative, collaborative approach. But these sort of interactions also obviously have their place, and they're important. Interestingly, this sentence was said by William Osler over 100 years ago. Okay, so he was obviously an icon of medicine. And I think as people who have responsibility for trainees, you really want to think about how you teach your trainees and think about how you connect to them. Learn to look up, learn as a leader. So one of the things that I've been really keen on, some of my the last few years in the UK, there's been a bit of negative press, or woe is us, and I've been really keen, certainly as the present president, that people showcase great work and they're proud to look up. And so these are a whole range of projects that we're doing that make us proud of who we are and drive the specialty forward. If you want to know more about the Royal College of Emergency Medicine, 50 years, we just edited a book. It's Money Goes to the Foundation, and but if you don't want to read the book, you can just read the graphic. And my last slide is from another president, as opposed to the one I might have quoted earlier. I think this is really us. I think, we are the change that we seek. Take that opportunity. Thank you.
Those of you, well, my own personal experience, Taj is a dear friend, and some of you might know that I spent about 10 years in Pakistan, feeling kind of lonely often about the challenges you have in the country and trying to develop people. And Taj, despite being so far away, had been a great source of support. And what you mentioned in terms of building those relationships have been really helpful and useful to me. Thank you, Taj. While we have a few minutes for any questions or any comments, again, please identify yourself and take this opportunity. So while we have people thinking, Taj, can I ask you something in emergency medicine? I see more and more people sort of feeling disconnected, especially at work, where they feel that they have very little power or influence in what's happening to their practice. And that sort of discussion then sort of negativity feeds each other, and suddenly you have the whole group that becomes negative, and there is people sort of feel so disconnected they give up and stop trying to improve things. Have you been able to find sort of how you bring in that positivity back, look at the positive, bright side of the practice, and make that change and become, be the change yourself? I mean, what's the advice or strategy you apply to your practice?
Okay. Thank you. So I think there are a couple of things. One is, within your department, you'll find people who are some of the key players, and you have to start sitting down with them and working out how they tick, and then within that, giving the opportunity for some specific projects. So they may not be your priorities, but they may be priorities for them. So there needs to be a little bit of give and take. So that will start that journey. And within that, I think also beginning to the showcasing work that I mentioned to you. I think many people want to use their energies for altruism and humanitarian work. And there are lots of opportunities that you don't have to go thousands of miles, but you can find ways to connect. So I think all of those sort of little bits and pieces are important.
Great. Thank you again. We have almost 3 years worth of reading after this talk. Appreciate the homework. Thank you all for being with us, and enjoy your lunch.